Alright, hi, my name is Leo. I'm an FNP student. Today we're going to be conducting a head to toe examination. Alright, please give me your full name and date of birth.
Michelle Yazov, May 5th, 2000.
Okay, do I have full consent to touch you in the examination? Alright, I'm going to start off by looking at your skin. Your skin looks homogeneous, no redness, no lesions. Do you have any pain or tenderness when I palpate? No pain, no tenderness, palpation of the skin. I'm going to start off with your head. I'm going to take a look at your scalp. Your scalp looks good, no great hair distribution, no redness, no lesions, no thinning, no balding. Do you have any pain upon palpation?
No.
No pain upon palpation, no masses noted. I'm going to quickly check for your temporal artery. Any pain? No pain, no tenderness. Checking for carotid artery, temporal artery pulses. Okay, +2 bilaterally. Very good. Normal findings. We're going to move down to your eyebrows. Your eyebrows are symmetrical, great hair distribution. Moving down to your eyelids, symmetrical, no redness, no lesions. Moving down to the eyelashes, they're intact, no redness, no lesions, symmetrical. Looking at the lateral and medial canthus, they're intact, no redness, no lesions, no discharge. Looking at the lacrimal system, it's intact, no redness, no lesions. Conjunctiva is pink and shiny, no redness, no lesions. Sclera is white, no redness, no lesions, no yellowing, no jaundice noted. Cornea is circle, no opacities, no redness, no lesions. The pupils are symmetrical and 3 millimeters in size. Very good. Now we're going to do a quick acuity test. I have the Rosenbaum chart here, 14 inches away from your face. Do me a favor and cover one eye and read the smallest letter from left to right.
LTFPH.
Now the other side.
LTFPH.
Okay, now both eyes.
LTFPH.
Okay, very good. Visual acuity is 20/20 bilaterally, telling us that the cranial nerve 2 is intact. We're going to move to the direct and indirect light reflex, the glare light reflex. I'm going to do the direct, directly into your left eye, seeing the pupillary reflex at 2 millimeters. Now I'm going to do the indirect or consensual. Do it on the left eye, look at the right eye. The right eye also constricts at 2 millimeters. Do the same thing for the opposite side. Direct on the right eye, pupillary constriction at 2 millimeters. Doing the same thing, indirect or consensual on the right eye, and then looking at the left eye constricts also at 2 millimeters. That tells us that the cranial nerve 3 is intact. Now we're going to do accommodation and convergence. We're going to start off with accommodation. Do me a favor and fixate your vision on the wall, and then look at my otoscope. Back at the wall. Okay, very good. Normal findings. The eyes are accommodating to the center, pupils are constricting. Very good normal findings. Now we're going to do convergence. Do me a favor, look at my pen. And then we're just going to bring it forward until the eyes converge. Very good, eyes converge, pupillary constriction is noted. Now we're going to check for your extraocular movement. Just follow this pen for me. Don't move your head. Okay, very good. Extraocular movement intact, telling us that the cranial nerve 3, 4, and 6 are all intact. And now we're just going to do the confrontational. This is just check your peripheral vision. I'm going to bring my hands from the back and tell me when you can start seeing them. Great. Peripheral vision is intact. Now we're going to do the fundoscopic examination. I'm going to turn the lights off. I'm going to turn on my fundoscope. I'm 15 inches away from the eye. I see the red light reflex, and I'm beginning to go in. I'm going in. I see the optic nerve, no edema there. No opacities in the cornea. The cornea is yellowish and shiny. No AV nicking, no redness, no lesions. We're going to do the same thing on the right side. 15 inches away from the eye. I see the red light reflex shining back at me. I'm going in closer. I see no AV nicking. No corneal abrasion, no corneal opacities. The disc to cup ratio is 1 to 2. Very good, normal findings. I'm going to turn back the lights on. We are finished with the eyes. We're going to move down to the nose. I'm going to begin by palpating the nose. Let me know if you feel any pain. No pain, no tenderness. How about your maxillary sinuses and temporal sinuses? And frontal sinuses, sorry? No. Okay, very good. Now we're going to check for the near patency. Close one nostril for me, breathe in and out. Okay, very good. Now the other side. Very good. Okay, now we're gonna check for the smell test. Do me a favor and close your eyes and close one nostril. Tell me what you smell. Alcohol, very good. Now for the other nostril, tell me what you smell. Close your eyes. Very good. Okay, olfactory nerve, cranial nerve number 1 is intact. Now we're gonna take a look inside the nose. Turn on my otoscope. Okay, very good. I'm gonna bring the tip of your nose up. I'm gonna go inside, and I see your nose. The nasal canal is gray, pink, and shiny. No nasal polyps. No septic deviation. Okay, no discharge. Same thing on the other side. I'm gonna bring the tip of your nose up. Look in. I see the nasal canal is pink and shiny. No nasal polyps. No deviation of the septum, no discharge. Very good. Normal findings. Moving on to the mouth. I'm looking at your lips. They're pink and shiny, skin's intact, no tearing. Open your mouth for me, please. I'm going to take a look at your teeth. Great dentation. The gums are pink and shiny, no redness, no lesion. Buccal mucosal region is pink and shiny, no redness, no lesion. Tongue is midline, no redness, no lesion, no white patches. Bring your tongue up, please. Look under your tongue, no redness, no lesions, pink and shiny. I'm gonna look on the top of the hard and soft palate. It's pink and shiny, no redness, no lesions. Do me a favor, stick your tongue out and say ah. Okay, tonsils are at +2, no redness, no lesions. And now we're gonna check quickly for the 9th and 10th cranial nerve. I'm gonna put this inside your mouth until you gag. Very good. Gag reflex is intact, telling us that cranial nerve 9 and 10 is intact. Now we're gonna move to your ears. I'm gonna bring your ears up. Okay. Looking at your ears, the auricle is symmetrical. Auricle is symmetrical. No redness, no lesions, any tenderness? No tenderness, no palpation. I'm gonna check for the mastoid process on both sides. Any tenderness? No redness, no lesions. Very good. Now we're gonna do a gross hearing test. Do me a favor, close your eyes and tell me which side you hear my fingers rubbing.
Right side. Right side.
Okay, very good. Gross hearing test passed, telling us the cranial nerve 8 is intact. Now we're going to do the Weber test. It's my tuning fork. I'm going to hit it and put it at the middle of your skull. You hear the sound bilaterally? Very good. No lateralization. Now we're going to do the Rene test. I'm going to hit this tuning fork, put it on your mastoid process. Tell me when it stops. Okay, and now?
Stop.
Very good. Left side ear is air conduction greater than bone conduction. Normal findings. Same thing on this side. Put on your mastoid process. Stop.
Yeah.
And now?
Stop.
Okay, very good. Air conduction is greater than bone conduction on the right ear. Now we are going to check inside the ear canal. I'm going to bring the left auricle up and back. And I'm going in. I see cerumen present. The ear canal is gray and pearly. Tympanic membrane is intact. No perforation. I see no discharge. Normal findings. Oh, let me check really quick. And the cone of light is 7 o'clock. Great normal findings. I'm going to check on the other side as well. Bring the auricle up and back. Going in, I see slight cerumen present. The ear canal is gray and pearly. Tympanic membrane is intact, no perforation, no discharge. Very good findings. Okay. Moving on to the neck. You can just look up for me. The neck is symmetrical, no edema, no redness, no lesions. I'm going to take a look at your trachea and palpate your trachea. Any pain or tenderness? No pain, no tenderness. Trachea is midline, no deviations. We're going to quickly check your thyroid. If you can swallow for me. Any pain or tenderness? No pain, no tenderness. My thyroid is midline, no nodules seen there. Now we're going to check for your chest. I'm going to start by inspecting your chest. Just breathe normally for me. Chest is expanding bilaterally, symmetrical. No excessive muscle use, no tripod position seen. Respiratory rate is at 12 to 14, which is normal. Now we're going to check the AP to bilateral AP to transverse ratio is 1 to 2, which is normal. I'm going to pretend to put a drape on you. I'm going to have you turn to that side. Okay, we're going to begin the posterior chest. I'm going to start with the palpation. Let me know if you feel any pain or tenderness. No? Okay, now we're going to percuss. I'm going to percuss for all the lung sounds. Okay, I hear resonance on all lung sounds. Now we're going to check for diaphragmatic exertion. Do me a favor, breathe in and out and hold the outward one. Actually, hold the inwards one. I'm sorry. Good. Okay, resonance stop here. Now let's do the same thing, but hold the outwards one. Okay, resonance stops here. I'm going to check with my camera length. This is about 6 centimeters, 4 centimeters, which tell me that this is a normal findings of the diaphragmatic excursion. Now we're going to do a quick palpation of the tactile femoris. Do me a favor and say 99 every time you feel my hands.
99, 99, 99, 99, 99.
Very good. Vibration felt bilaterally. We're going to move on to the auscultation. We're going to auscultate all of the lung fields. Breathe in and out normally. Okay, very good. No adventitious lung sounds heard all around. Now we are going to auscultate for the egophony. Do me a favor and say EED every time you feel my stethoscope. Okay, very good. You heard clearly, no A sound, so no consolidation. Now I'm going to check for whisper pectorality. You're going to whisper 1, 2, 3 every time you feel my stethoscope. Okay, very good. The whisper sound heard muffled, which means no consolidation. I'm going to turn you this way now. We're going to check the front of the chest. I'm going to begin by palpating. Do you have any tenderness? No tenderness. Okay, no tenderness upon palpation. We're going to percuss all the lung fields. Okay, very good. Resonance heard all around, and now we're quickly going to auscultate the lung field. Breathe in and out normally as you would. Okay, very good. No adventitious lung sounds heard on all of the lung fields. Now we're going to move to the cardiac. Okay, I'm just going to inspect your chest, and I'm going to see the respiration is normal, and we're going to move to the inspection. Respiration is normal. I don't see any abnormalities. Okay, we're going to move to the identification of the landmarks. So on the right intercostal space, on the right second intercostal space, we have the aortic valve. Left second intercostal space, we have the pulmonic. Third left intercostal space, we have the Erb's point. Fourth left intercostal space is the tricuspid valve, and the fifth intercostal space, mid-clavicular line, is our mitral valve. Now we're going to auscultate these regions with the diaphragm and the bell. Aortic, pulmonic, Erb's, mitral. thing with the belt. Okay, now lean forward for me. We're just gonna check the mitral with the belt and diaphragm. Now the diaphragm. Okay, very good. No extra no extra heart sounds heard. S1 and S2 is present. Now I'm gonna have you lay back. I'm gonna put the bed at 30 degrees. Okay, we're gonna check for your jugular vein distension. I'm gonna have you turn to the right side. I'm gonna look at your jugular vein region. I don't see any jugular vein distension. I see the pulse. And now I'm gonna palpate for the carotid artery. Look forward for me. Okay, bilateral +2 carotid artery, normal findings. Now we're going to palpate the 4 landmarks for any bruits or heaves. Okay, no bruits, no heaves. And then we're just going to check the pulse PMI. Okay, very good. Pulse is palpable. All right, and now I'm just going to auscultate these regions as well at 30 degrees. Okay, now with the belt. Okay, very good. No extra hard sounds heard. S1 and S2 is there. Now we are going to do the vascular portion of this test. I'm just going to look at your lower and upper extremities. I don't see any edema. I don't see any cyanosis or any clubbing of the fingers. Right now we are going to check the pulses. I'm going to check the brachial pulse bilaterally. Okay, I'm going to check the radial pulse. Okay, the femoral pulse. The dorsalis pedalis. And the posterior tibial. Alright, all pulsations are felt at +2, which is normal findings. And now we are going to let's see, right? Copy. Okay, that's it. Now we're going to move to the musculoskeletal. Okay, we're going to move to the abdomen. Okay, so we're going to start with the inspection of the abdomen. Looking at the abdomen, no protuberance, no excessive bloating, no abdominal, aortic abdominal pulsation, great abdominal contour. Okay, now we're going to do the palpation. No, we're going to do the percussion, auscultation, I'm sorry. We're going to do the auscultation and follow the EOP. I'm going to start with the right lower quadrant, moving clockwise. Okay, please hear normal active abdominal sounds on all 4 quadrants. Now we're going to do the percussion. I'm going to percuss the liver sides, starting with the clavicular line. Okay, we stop here. Now we're going to do it from the bottom. Okay, it looks about 6 inches, which is normal findings of liver size, no hepatomegaly. We're going to percuss the spleen size from the mid-axillary line, right over here, going into the center. Okay, dome is stopped over here. Looks like it's about 7 centimeters. This is normal spleen size, no splenomegaly. Now we're just going to percuss the 4 quadrants, starting from the right lower, right upper, left upper, left lower. Okay, tympanic sounds heard all around the 4 sounds, the 4 quadrants. Now we're going to move to the palpation. I'm going to bring you down. Okay, I'm going to palpate, light palpation from the right lower quadrant. Any pain or tenderness? No pain, no tenderness, no masses felt. Now we're going to do deep. Any pain or tenderness? No pain, no tenderness. Now we are going to palpate for the liver. In your favor, breathe in. Okay, any pain and tenderness? No pain, no tenderness. Liver is palpable. Now we're going to check for the spleen. Any pain or tenderness? No pain, no tenderness. Spleen is non-palpable. Alright, we're going to move down to the musculoskeletal. I'm going to have you stand up, please. Oh, wait, I forgot one thing. Come back up. We're going to do the CBA tenderness. I'm going to give you a little blow to the back. Can you tell me if you feel any pain?
No. No.
Okay, very good. No cerebral coastal pain or tenderness. Moving down to the musculoskeletal, I'm going to have you walk 10 feet there and back. Okay, we're checking for your gait. Your gait is symmetrical, no shuffling, no dyskinesia. Very good. Now I'm going to inspect your spine. Your hairs, please. Thank you. I'm going to palpate. Let me know if you feel any pain. No pain. No pain, no tenderness. Now I'm going to palpate your spinal muscular muscles on the side. Any pain or tenderness? No pain, no tenderness. Now I'm going to check for the range of motion of your spine. Do me a favor and touch your toes. Okay, now the other way back. Okay, now left and right. Okay, and just swing your hips circle. Very good. Full range of motion on the spine. I'm going to have you sit back again. I'm going to check for your TMJ. Okay, I'm going to palpate the TMJ. Any pain or tenderness? No pain or tenderness. Do me a favor. Open your mouth. Close it. Now open it and move it side to side. Okay, protrude it forward. Very good. Good findings. Full range of motion on the TMJ. We're going to do your shoulders. Shrug your shoulders up. Okay, very good. Now I'm going to have you bring your bring your hands up behind you. Okay, now this way. Okay, now bring your hands on your head and behind your back on both sides. Okay, full range of motions on the shoulder, flexion, extension, internal, external rotation. Okay, now moving down to the elbows. Any pain upon palpation? No pain, no edema, no fluid felt. We're going to check the range of motion. Do me a favor, flex, now extend. Okay, great, full range of motion. We're going to check your wrists. Any pain? No pain, no tenderness. We're going to check the range of motion. Bring them up, down, abduct, abduct. Very good, full range of motion on the wrist. And now we're going to check quickly for the elbows. I forgot one exam. Bring your hands forward, supinate, and pronate. Very good, full range of motion on your elbows. We're going to check your fingers and hands. Any pain upon palpation? No pain, no tenderness, no nodules felt. Very good. Now we're going to check your hip. Let me feel it lie back. Yeah, lie back. I'm going to bring this down. Okay, bring your knee up. Very good. Okay, and now bring it straight down. Okay, very good. Now we're going to check for abduction. Bring it towards me. And now back. Okay, now we're going to do internal and external hip rotation. This is external. This is internal. Very good. Full range of motion on your hips. I'm just going to palpate. Do you have any pain on the hips? No pain, no tenderness. We're going to check your knees. Any pain? No pain, no tenderness upon palpation. Do me a favor, extend your knee forward and now bring it back down. Very good. Full range of motion on the knees. We're going to check your ankles. Any pain? No pain, no tenderness. We're going to check the strength of the range of motion in your ankles. Bring them up, bring them down, inwards, now outwards. Very good. Full range of motion there. And now we're going to check the feet and toes. Any pain? No pain. Very good. Bring your toes up. Okay, and now down. Okay, perfect. Full range of motion and there. Now we're going to move on to the neuro. We're going to do cranial nerves. Okay, so we already did cranial nerve 1, we did 2, we did 3, 4, and 6. Now we're going to check the 5th one, which is the trigeminal one. There's 2 portions of it. There's motor and sensory. We're going to hit the sensory first. Close your eyes, please, and tell me which side do you feel my touch on your face.
Left side.
Where is it though? Okay, now this side.
Right cheek.
Beautiful. Now this one.
Left cheek.
Okay, very good. Sensory version of the trigeminal nerve is intact. We're going to check for the motor. Do me a favor and clench your teeth. good. Very good. Great muscle contraction. Trigeminal nerve motor is intact. 6 we already did. 7 is the facial. Do me a favor and smile, frown, puff your cheeks, and bring your eyebrows up. Okay, the motor version of the cranial nerve 7 is intact. Moving to the 8, we already did that at the gross hearing. 9 and 10, we did that as well. The motor version when I checked the gag reflex. And now we're going to do the sensory of 7, 9, and 10. I'm going to have you stick your tongue out and close your eyes and tell me what flavor you feel at the anterior portion of your tongue. Okay, I'll pull it out, the posterior version of your tongue. And in the base, very good. All 7, 9, and 10 cranial nerves are intact, sensory version. Now we're going to move to the 11th cranial nerve. This is the shoulders. Shrug your shoulders. Now move it left and right, and front and back. Very good. Cranial nerve 11 is intact. And lastly, the cranial nerve 12 is your tongue. Stick your tongue out, bring it up, down, left, right. Very good. We are moving on to the motor. Now I'm going to check the strength on all of your muscles. We're going to start off with your neck. So we'll bring it forward towards my hand against my resistance. Now back. Very good. Now left and right. Okay, very good. Neck is strong, 5 out of 5. We're going to move down to the shoulders. Shrug your hands, your shoulders up against my resistance. Very good. Bring your arms to the side and just straight and bring them up against my resistance. Down against my resistance, forward and up. Very good. And back. Very good. Shoulders is 5 out of 5 in strength. We're going to check for your elbow strength. Do me a favor and flex your elbows against my resistance. Now the other way around. Very good. Elbow strength is 5 out of 5. We're going to check the wrist strength. Pick your wrist strength up. This way, up towards me. Very good. Now downwards. Very good. Now outwards and inwards. Very good. 5 out of 5 out of the strength. Then we're going to check the finger strength. Bring your fingers up. Now down. Very good. Finger strength is full 5 out of 5. I'm going to check the hip strength. Move your lay down, please. Bring your knee up against my hand, and now downwards against my hand, and outwards against my hand, and inwards. Very good. Okay. I'm going to check for your 5 out of 5 on the hips, by the way. I'm going to check for the knee strength. Extend your knee against my resistance, and I'll bring it back. Very good. The strong knees, 5 out of 5. We're going to check the ankle strength. And fair, bring your feet up. Okay, now down. Very good, very strong. 5 out of 5. And then we're going to do a quick toe exam. Bring your toes up against mine. Down. Very good. 5 out of 5. Now we're going to move to the sensory version of this test. This mostly is going to have you being with your eyes closed. We're going to check for light touch, pain, sharp dullness, and yeah, we're going to move through it. So do me a favor and close your eyes. Tell me exactly where you feel the pain.
Left arm, right leg, left leg.
Very good. Now we are going to do a light touch. Tell me exactly where you feel the light touch. Close your eyes, please.
Left cheek, right arm, left leg.
Very good. Light touch is passed. Now we're going to do sharp and dull. This is sharp. This is dull. Okay? Tell me where you feel it. Sharp and dull.
Sharp, 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 dull.
Very good. Sharp and dull is passed. No abnormal findings. Now I'm going to have you bring your hands out. We're going to do something called stereogenesis. I'm going to put something in your hand and you're going to tell me exactly what you think it might feel like.
Lollipop.
Lollipop. Very good. Now about this hand.
Bottle.
Very good. And now we're going to do the last one on the sensory is the vibration. I'm going to take a tuning fork here. Close your eyes, please. I'm going to put this on a bony prominence and let me know when you feel the vibration and when you stop feeling it, okay?
Start. Stop.
Very good. Okay, now we're going to move to balance and coordination. I'm going to have you stand up, please. Okay. Now I'm going to have you walk back and forth, heel to toe, please, as if you're being tested for your drunkenness. All right, very good. Come back. Alright, very good. Now do me a favor, walk there on your toes. Very good. And walk back on your heels. Okay, very good. We're standing right here. Use the bed as your back wall. We're going to check for Romberg test. Feet together. Close your eyes. I got you, don't worry. We're just going to check if you're swinging. Okay, very good. Romberg test passed. No swinging noted. And I'm going to have you sit down once again. Alright, and we're going to do something called heel to shin. I'm going to bring this up a little bit, more comfortable for you. Do me a favor, take your heel and roll it down your shin on both legs. Oh no, I'm sorry, you were supposed to close your eyes. Will you do that for me? Very good, perfect. And lastly, we're going to check the reflexes. Okay? I'm going to do the brachial reflex. No, the bicep reflex. Very good. Now the other side. Okay. Tricep reflex. Okay, very good. Now the other side. Very good. Now I'm going to check the brachial tibial reflex. Very good. Okay, very good. Now I'm going to check the quadricep patella reflex. Just relax your legs. Very good. Now this side. Okay, very good. Now stand up for me. We're going to check the Achilles tendon. Over here. Put your knee. Yeah. Put your knee over. I'm going to hit you in the Achilles tendon. Ready? Good. Now the other side. Ready? Okay, very good. And that concludes our examination. Thank you so much.
Thank you.